we're talking about the non-stance leg as our initial reference, okay? So if I'm going to talk, we'll stay talking right, okay? If I'm talking about a right rotation at the pelvis, the right leg is off the ground, okay? And it is either a right forward rotation or anterior rotation or a right posterior rotation. Okay, it's the non-stance leg that is the reference for the rotation, okay? So, right posterior rotation, right anterior rotation, like that, okay? Every question I ask you about when I ask you about a right pelvic or anterior or posterior rotation will be about the left leg, okay? Because that's the leg on the ground. So, all right. I will also not ask you about muscle use with this, okay? It's confusing enough with just talking about what joint motions are occurring, okay? So if I am in a right anterior rotation, it looks like this, okay? And because when I walk, my chest stays forward and I do it with a contralateral arm swing, we're going to maintain that, okay? So we're not walking like this, right? Walking like this where the hips move and the chest stays anterior, okay? So if I do this, okay, if I move this hip anteriorly and my chest, and I'll exaggerate it, my chest stays forward, what lumbar motion is occurring during a right anterior movement? What lumbar motion? Rotation to the right. Okay? So if I then, so I maintain, so I do this, okay? And we'll capture that picture, put my hips back where they were. That's right-sided rotation, correct? Can we agree on that? Okay. So, when we talked about pelvic motions, they're just combinations of hip and lumbar motions. So, if I'm like this, taking a giant step forward, my trunk is like this, okay? Which way is my left hip moving? And we're thinking about rotation motion.
Left posterior.
Okay, but what do we talk about in the hip motions? We talk about medial and lateral rotation, right? Okay, so if we talk about my hip joint on this side, my toes are face forward, take that snapshot, right? And then bring that foot back. Which way is that hip going? Internal rotation. Okay? So if I'm in a right-sided anterior rotation, okay? Lumbar rotation is to the same side, okay? And we have internal rotation of the hip, okay?
Of the left one.
The left hip. Because it's always going to be questions about the left when I'm talking about a right anterior or posterior rotation, okay? So, if we talk about a right posterior rotation, okay?